Hi there, welcome back to my channel. I am Dr. Michelle Scoggins. I'm a licensed psychologist, but for the purpose of this video series, I'm actually the patient. And so I'm walking you through my process of getting a hysterectomy. Today was my appointment for my pre-op. My surgery is scheduled for next Tuesday, so just 7 days away. And I'm super excited, but there were some key things that my doctor did go over that I feel are valuable for ladies who are interested in having the hysterectomy. I will have a robotic surgery, and so there will be a few incisions done on my stomach, and he will go in robotically and remove my uterus, my cervix, and my fallopian tubes. He will then reposition my bladder and have that connected in between the two muscles that go down through your vagina wall, I guess you would call it. I don't know all of the medical terms. Maybe I'll post it in there. I'm not sure what that's called. He did say that, but I just can't remember what those two muscles are, but he will reposition where my bladder is kind of woven into that and holds it up. The things that I wanted to share today that were really helpful and makes me feel a lot more comfortable. One is that I never even thought of this, but you have the leg compression sleeves that they put on you in the hospital anytime you have surgery to kind of reduce the occurrence of developing blood clots. And so what they gave me was a take-home version of this product. And so that will be done in the hospital. But then when I come home, I will have this for 2 weeks. They suggest wearing this anytime that I'm sitting down, laying down, or doing nothing. And they are just these little compression socks that are rechargeable. And the scheduling tech said they're actually really comfortable if you have a long day at work. So I will probably use these for some time to come if I've had a long day. So these are what the sleeves look like. And then they have a battery pack that you can recharge them on. So I'm really kind of excited to try that. The second thing that he did, and I have not heard of this before and not been discussed in other videos that I have personally watched, and it's this cool little Ono or On-Q pain reliever system. Okay. And so what this is after my surgery is complete, I will have a catheter in one of the incision sites with a Band-Aid over it, and it will have this little pump full of pain medications, and that comes home with me. I hook this onto my clothing, and over a course of 3 to 5 days, I believe he said, the bladder will start to shrink as the medication goes through the catheter and into my body. Once the pain medication has been utilized, I just remove the Band-Aid, pull the catheter out, and throw it in the trash. And so that's a really cool. The reason this has been helpful, the doctor mentioned, and even the surgery scheduler, is that it reduces your need to have narcotic pain medications, which are your leading causes of having constipation after surgery. And so this avoids that whole constipation thing after your surgery, and that they noticed that the rate in which women are using the narcotics while having this is a lot lower. And so your risk of constipation is a lot lower. The other thing that, is happening, and this is only kind of the COVID era, because I hope that these videos stay evergreen and they can be helpful for years to come, is I will have to have a COVID test before, maybe a couple days before I go into surgery, and I will have to quarantine after I have that COVID test until I arrive at the hospital. So that's something that is new and different if you were having a hysterectomy during COVID times. So I thought that was just really cool part to share with anyone who's thinking of getting a hysterectomy or in the process. These are two pieces of equipment that if your doctor isn't mentioning, I would highly question it and ask them if this is something you can have. Is this on cue? And then the leg compression sleeves. I'm not sure if I showed you the brand name of the leg compression sleeves. So, and those are billable. Both of those items are billable to your insurance company. And so that's an added benefit for whomever is thinking of doing this type of a surgery. And so from this point on, it's just all the psychological feelings that I'm experiencing going into this process and leading up to that. I think today I could say that I was a little bit worried only after my appointment, because again, my doctor gave me a huge folder of things, and I signed a lot of paperwork, consents, agreeing to the surgery. And so it just brought in some kind of emotions. This is a big deal. It's something I really want. I don't want any more children. So having this body part isn't something I necessarily want to keep, but just going under and having surgery is a little scary. And so that's, from this point on, I might do a couple of videos just in relation to how I'm feeling psychologically as I prepare for this. The other thing is, life happens no matter what. And I've had a recent elder in my family pass away, and their service will be Monday. I don't think I will be able to attend that service just because my surgery is on Tuesday, and they're anticipating that I will get my COVID test on Sunday. And so if I get my COVID test on Sunday, I have to quarantine until the surgery. So that's the only thing, is knowing that life still happens and we can't prevent it, and we just have to roll with what the universe is handing us. So again, guys, I hope these are helpful. Comment in the comment section, subscribe to my channel, give me a like if these have been helpful. And if there are any questions you have along the way, or as I'm going along the way, that you would like for me to answer or ask my doctor, please feel free to ask those questions. I am a complete open book, because I want more women to feel comfortable sharing their process of having a hysterectomy. So until next time, guys, I'm signing off. I've had the pre-op and I'm super excited, and I will be back. I will be back with some more videos for you guys real soon. Take care.